Welcome to VPG's Virtual Water Cooler Chat Podcast, a platform that features professionals across a variety of industries and promotes growth mindset principles with a central pillar of championing the achievements of women. Our conversations explore a wide spectrum of backgrounds, experiences, and perspectives, creating a vibrant mosaic that enriches our collective understanding and strengthens our commitment to growth and empowerment. Today, Shenique Reid, a dedicated case manager in the healthcare field and VPG litigation and communication specialist, is speaking with seasoned IP lawyer and pharmacist Katherine Rubino. Katherine combines her expertise in legal writing, patent strategy, and corporate governance to drive innovation. Katherine has been featured in the Wall Street Journal, Fox Business, and Nature Biotechnology for her contributions to legal and scientific advancements, chairs the Chemistry and the Law Division of the American Chemical Society, and actively supports the entrepreneurial ecosystem by providing pro bono legal counsel through MIT Sandbox and the Oregon Bioscience Incubator. Let's get started.
Hi, Katie. How are you doing today?
Hi, Shenique. Great. How about you?
I'm doing well. Hello, my name is Shenique. I've been with VPG for about 6 months now. I'm a litigation specialist and I enjoy what I do at VPG. I just wanted to find out, how did you meet Ashley Chung?
Yes, so that's a funny story. In the world of the virtual universe, we met over LinkedIn and then we ended up both being on this Femtech Live podcast together last year. And so we've just kept in touch and we both work in the IP space. So it's been a great way to keep track of the different cases and interesting work that we've both been working on here.
So, Katie, I just had a couple of questions for you. In the world where AI is becoming more present, if you could have an AI-powered assistant to help you with your day-to-day tasks, what would you have it do?
Oh, wow. That's such a good question. I think I would love for it to triage my inbox and kind of be able to flag most crucial things that I must respond to right away and other things that I can come back to later. Because I feel like sometimes we can be so busy working and we get so many messages that you don't want to have things fall through the cracks, and having some little bot that could keep me on task would be very useful.
It would be very useful. I sometimes feel like those filter options in the email are not very effective.
Right.
Yeah, that is great. I know that you've been in the law field and in the healthcare field for an extensive amount of time. So since the pandemic, there have been so many AI tools that have emerged. Do you think any one tool has had the biggest impact on healthcare?
You know, that's a good question. I'd say I've noticed this myself just even in the past maybe year or two as just a patient at a doctor's office, that so many doctors are integrating AI into their practice. I think the pandemic did a great job because of the nature of the pandemic and the need to isolate from people. We had to create tools that could allow us to teleport to remote areas or to other patient rooms where maybe they were very sick, so we couldn't go in there. So it created these tools for remote monitoring, for telemedicine. And so all of that has really driven healthcare forward, where then I think the healthcare system was more ready to adopt AI tools. And now you see it all the time. I mean, even just in diagnoses, doctors have different AI tools that can help them input symptoms and figure out what's really going on, or figure out the best treatment plans or drug interactions. So I think we're just at the forefront of it, but I think COVID definitely helped spur on adoptability of these tools, because during that time we had to use the tools in order to be able to do our job. So I think it'll be interesting to see where the future of this really goes.
Absolutely. With pharmaceuticals being in the healthcare sector and having so much large data sets, what are your thoughts on using AI as it relates to the privacy and security concerns?
We've seen this definitely pop up a lot with OpenAI sources, where most people, when they go log on to some sort of OpenAI, there's all these terms and services that you have to kind of click through. And a lot of them have some very detailed instructions about IP ownership. and I bring this up not to provide legal advice here, but for informational purposes only, to say that a lot of those consents can really have down the stream effects on IP ownership and IP rights. So you have to kind of be careful if you're using those tools, how you're using them to, you don't want to share sensitive data. And I think probably as different AI tools move forward too, there is always this cybersecurity threat.
Yes.
So we need to be careful to find ways that we can still use these tools, but do it in a way that's safe for everybody too.
Yes, yes. And I know a lot of people do input their data into these tools, and safety and security and privacy is one aspect. But how about from an ethical and a legal standpoint when it comes to like patenting this technology or, keeping it safe for the users?
I mean, I think we've seen a lot of these scenarios play out in the past year in the legal industry where lawyers go write these briefs and they cite cases that they pulled from sources that don't really exist. And, I think it can really create problems. So you have to be careful. They're useful tools for looking up information gathering quickly or to maybe learn about certain areas, especially in the patenting world. A lot of what you write patents about, you have to go learn about it and figure it out so that you know a lot about it, even more so than your client. So then you can write a really robust patent about it. So I think they're helpful, but would I rely on them exclusively? No, you need to be careful and still check the accuracy of the information that they provide too.
I totally agree.
Yeah. Do you think too, have you seen in law schools a lot of adoption of these tools?
Well, I haven't quite started law school yet. I'm
Okay.
studying right now to take the LSAT, but I do have some experience in healthcare. We use the electronic health record system, and I do see how we have integrated AI into auto-populating stuff when it comes to patient data and also maybe some drug-to-drug interactions. We see AI will say, oh, well, don't do too much of this because this person's already taking this medication. So it has been useful, but I am concerned about how much information it does know about each individual patient and how that can have long-term effects.
Well, I think too, what people are learning also is that the AI really is as good as the data that it's trained on. And especially in healthcare too, that if it's not an area where maybe the model knows a lot or has been exposed to a lot, it can also generate outcomes that aren't as clinically relevant too. So it's something to keep in mind.
That is true. So, another question I do have for you, as a woman thriving in both law, pharmaceuticals, and technology, how do you see yourself inspiring the next generation of women to break into these traditionally male-dominated roles?
For example, when I was in law school and took a patent law class, I was one of two women in the whole class. So it definitely can be a male-dominated field. But I think as with anything, you have to stick together with other women and also look for mentors in the field too. So there's a lot of different really great IP organizations that are specifically designed for women in IP. So one of them is this network that started in New York City called WIN, Women in Intellectual Property Law Network. And they have events all over the country, and it's something you can definitely check out. But it's a great group of women who have some connection to IP. Could be they work in a law firm or they work in-house at a drug company, but it's a great way to connect and collaborate and get to know other women in the field too, and kind of learn from their experiences and what has worked for them and what hasn't. And I think too, at the end of the day, just going to events that are curated for women in the IP space too. There's a lot of female VC funds that only focus on investments in women-run companies or that only invest in companies that are solving issues on women women's healthcare. So there's a lot of niche ways to get involved in communities that support women across the industry.
Yes, and I do see where mentorship is extremely helpful, like having a successful group of women that can help to guide.
Especially when you know you're new and you can be navigating this new industry that you don't know about. And then it's also, you're kind of just in this room full of men, which can be intimidating. So it can be good to get some kind of mentorship and advice and feedback as to what to do and how to act, and just get really good advice there too.
Are you currently mentoring anyone in particular, or are you currently playing a mentorship role in any potential student or lawyer's life?
Yes. So I went to Suffolk Law School in Boston. That's where I attended. And so I have different students who reach out all the time. And a lot of them are curious about what do certain jobs in IP look like, or maybe they don't know how to break into a law firm, or they have questions. So I always welcome anybody to reach out, and I'd be happy to speak with them and mentor them and kind of point them in the right direction.
Yeah, I once asked one of my friends who is an IP attorney, what should I do when I'm trying to find a mentor in the field I'm looking for? And he says, well, lawyers like to talk and they like to eat. So invite them out to lunch. And I was like, okay, that's great advice.
That is good advice. And don't be afraid to do a cold call, right? Just email them. You can't hurt anything. Okay, they don't respond. Move on to the next one, right? Or chances are they probably will respond and they'll want to hop on a call or grab a coffee. So it can be a good way to build your network out. And at first it can be very awkward too, because it's just something they don't teach you in school. But I think once you do it a few times, you realize, wow, there really are people who are willing to kind of help me out and whose experiences I can learn from.
I appreciate that. Thank you. Thank you for confirming the advice.
Definitely. Well, and I've been there too. I remember when I was in law school, I was like, oh, doing a cold outreach seems weird. And are they even going to respond? But now I just kind of look back on that and laugh, because if they don't respond, so what? Next person. It's nothing personal. It's just people get busy. But I think it's a great way to kind of meet people and gain valuable insights as you're building your career.
Exactly. Okay, thank you. So I had another question for you. With AI automating so much of what humans are doing, are you concerned that AI will take over the workforce in the future, or that human work will be indispensable?
This comes up quite a bit. I don't think we're anywhere near a place where AI is going to just replace humans. There's still this human interaction and human eyes that need to go on things, but I think we shouldn't be afraid of AI. I think where people will get left behind is if they don't adopt it, because there are ways you can use it to work faster, work quicker. It's never going to replace you, but there's ways to integrate it into your daily routine that I think will save time and money down the road. But I think the people who are hesitant or nervous and don't want to try it, they're the ones who will be left out here.
Yeah, there is one place I'm hoping AI does not replace human, and that's definitely when you call in to check on a bill or a service and the automation keeps asking you to repeat yourself. I'm like, give me a human, please. They'll say, I can help you. I'm like, no, you can't.
I think we've all been frustrated by that on numerous occasions.
When AI systems make decisions or cause harm, who do you think should be held accountable?
Oh, wow, that's tough. I don't know. It's hard because these AI tools scrape data and they try to stay current on things, but I think that's almost impossible at sometimes, just because things can change so quickly that it would be hard for me to envision a way that they could be totally accurate all the time. So I think as a user of an AI platform, you have to be aware of that and still check the information to know that it's legit and makes sense. So I think as a user, you kind of take on some responsibility there, but also the AI company too. There's some responsibility they need to take in making sure sure that the products that they launch and put forth are not just going to cause mass amounts of harm either.
Yeah, or misinformation. I recently noticed some open source AI starting to source their material. So it would give me an answer and go, by the way, click this link and you'll go right to the source. So I thought that was pretty useful.
Oh, that's interesting.
Yeah, it seems like it's something new. We're going to dive back a little bit to healthcare. So, do you view AI as a disruptive force that could replace traditional pharmaceutical roles? I know you mentioned earlier you don't think it's going to replace humans in the workforce, but how about the pharmaceutical sector?
Where I've seen it really get adopted recently is with integrating into some kind of software component to help speed up drug development and clinical trials. So now with AI, companies can create platforms that can help source drugs or drug targets or model disease states. And so I think that definitely helps accelerate the time to get a drug to market. So that's definitely quicker. And I think down the road too, it'll be a useful tool to model different disease states and get used to obtain clinical trial data so that we don't need to spend as much time testing rats and collecting all this data. So I think we're at the early days of that. But even in the past 3 or 4 years, I've seen a huge shift in really the life sciences sector in general, where traditionally you have a life science, which is creating all these innovative drugs and therapies, and then you have your tech innovations. But I'd say there's been kind of a crossover because there is so much data that's getting generated, and these bioinformatics platforms are getting made that can really accelerate things rather quickly.
Well, it's interesting to learn that it could help to speed up drug production. I wonder how that will impact safety and efficacy. I know it's collecting data, but I wonder if that will have an impact on those terms.
Right. Well, and something, that's interesting too is it wasn't until the 1990s that women were allowed in clinical trials. So what that means too is that a lot of data sets that are used to test different drugs are mostly male-driven models. So that's where too, I think AI will come into play to be able to create these data sets around different groups that maybe metabolize drugs differently or that need different doses of drugs. And so the data that will get generated will really be able to create very personalized recommendations that take into account a lot of physiological differences between people too.
I'm glad that you mentioned different groups of people because I was going to ask, how do you see women in particular influencing the ethical use of AI in these industries?
I think there's a huge movement with AI to create solutions that are tailored for women, because what we're learning too is that women's different physiological makeup and their hormones and everything causes them to process drugs and treatments differently than men. That's never really captured in a prescription. If you get sick, the same dose of a drug for a woman is the same dose that's being given to a man. And so there can be great variance in how each of them will metabolize the drug and even what dose of drug they need. So I think it will really answer a lot of these lingering questions about how do these physiological differences really impact and customize treatment. Because right now we just sort of operate under this one size fits all approach, but maybe that isn't the best approach. And maybe we need to look at two different disease states are more prevalent in women. So we know, for example, autoimmune disease, right? I think something like 2/3 of it is in women. So there's some physiological makeup or signaling pathway that's driving women's bodies to attack themselves and present as things like lupus and MS and ulcerative colitis. So I think that's an answer AI can help us get to faster too, is why are some diseases more common in women or have different presentations? Another area, heart attacks, right? We know women are misdiagnosed so often with a heart attack because they have different symptoms, right? They they don't have that classical chest pain. A lot of times it's GI related or arm pain. And so those are the symptoms that most doctors don't associate with a heart attack. And that's where a lot of cardiac events can go missed. And so that's another area too, where I think AI can help assess patients better and come up with diagnoses that intervene quicker and hopefully save lives too.
Yeah, and potentially be more suitable for the patient and their demographic.
Exactly.
I find it interesting that you spoke about the dosing between men, women, because you oftentimes when I look at the back of like a bottle or something, I just see children and adults. I'm like, okay, what about elderly or men or women? I think that would also be helpful, just kind of breaking that up a little bit more. Yeah.
Absolutely. Even teenagers and people at different stages of their life have different physiological function of their liver and their kidneys, right? And so we never really take that into account when we dose a drug. So I think that's too a very interesting reason. And I think it could also help a lot of people maybe become more compliant with their drugs too, because a lot of times they stop taking them because they have so many side effects because the dose is wrong. And so I think it's a great way that it could really customize and help drive better health outcomes too.
I agree. My last question for you is, what piece of advice would you give a young attorney that wants to branch into a role in IP or any law that they're nervous about because it is maybe more male dominated, or, they're just a little nervous?
This is a totally normal reaction. Transitioning from law school to a job as an attorney, it can be a very difficult transition because, number one, if you don't work in law during law school, it can be hard to get your foot in the door in a firm right off the bat, especially in the IP field, just because it is pretty competitive. So, piece of advice there, number one, is don't get discouraged. You'll get handed so many rejections, and I had this happen to myself too. And it's soul crushing, especially when you submit a job application online and you get a rejection within like 3 minutes of submitting your resume. So some bot just scanned it and didn't pick up on anything. And so, within minutes you have this rejection and it's like, okay, they didn't even look at it. But don't get overly worked up. It's a game of persistence. And so you just have to keep at it, and eventually something's going to open up, and you have to temper your expectations a little bit, because once you land that first job, then that's going to give you credibility and experience in the profession, and you'll learn stuff, and that'll allow for greater mobility later on if you want to go in-house or go to a different firm or go work at a law school. But you have to kind of get a little bit of practice in first to then be able to kind of go try out other parts of the profession. But I think being nervous, it's totally normal. And law firms know if you're coming in with no experience. So they have a lot of systems in place to give you training, expertise, mentorship, and help really get you up the learning curve so that you start to gain confidence and gain experience to do things independently too.
And I was going to piggyback really quickly off of what you said about the resumes and just getting that automatic rejection. I did learn recently that some open source AI tools allow you to plug your resume in along with like a job description to kind of tailor your resume more, because it knows a bot is going to like review it first. And if you don't have certain keywords, you'll just get dismissed. So that's a great tip that anyone can use to,
That's a really good tip. Yeah. And I usually tell people to read the job description, figure out what they're looking for, and then write your resume in a way that conveys what relevant experience you have geared towards what they're looking for. Because then if it is screened by a bot, if you have some of those keywords in there and you have the experience they're looking for, it'll help move your application along.
Well, thank you so much, Katie. I really enjoyed speaking with you today.
Me too. Thanks so much for having me.